When it comes to heart health, is your heart in the right hands? You can count on it with St. Luke's. They're nationally recognized as one of the leading heart and vascular centers. On tonight's episode of Health Now, we'll dive deep into the field of heart care and the various services that are helping patients at St. Luke's. I'm Ashley Russo, and this is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at heart care offered at St. Luke's University Health Network. Stay tuned. Thanks for joining us. Our first panelist here tonight is Dr. Jake Murray, a cardiologist with St. Luke's Cardiology Associates. Board certified in general cardiology, his special interests include preventative cardiology, hypertension, and coronary artery disease. Dr. Murray has a strong interest in preventative care and counsels his patients on food as health and making heart-healthy lifestyle choices. Dr. Murray, thank you for being here.
Thank you for having me.
So tell me a little bit about your field and your specialty and why you went into it.
My grandmother died young from heart disease, heart failure. And as my parents tell me, about 5 years old, that's when I started sort of talking about an interest in medicine in general. So that really is what threw me into cardiology eventually.
And what drew you to the field once you started to study medicine, to cardiology particularly?
Fascination with the organ itself. Just an incredible machine, studying the physics of it, really. I was a bit of a math kid as a youngster, and so the physics of the mechanics of the heart muscle is really what got me into it.
Tell us a little bit about the training that goes into being a cardiologist, because it's a pretty long road until you're actually practicing.
It's a long road. Started college at 18. Got out of cardiology training at age 32, so it's about a 14-year track.
Unbelievable. Well, thank you so much. We're looking forward to hearing more from you.
Pleasure.
Joining our panel next is Dr. Evan Joy, an advanced heart failure and cardiac transplant cardiologist for St. Luke's University Health Network. Dr. Joy is board certified in internal medicine, general cardiology, advanced heart failure, cardiac transplantation, and adult echocardiography. Dr. Joy treats cardiovascular problems from general discomfort to complex diseases. Dr. Joy, thanks for being here.
Thank you.
How did you make the decision to become a cardiologist and then subspecialize within heart failure?
It was a number of different factors. I actually didn't grow up with a childhood dream of becoming a physician. This developed over time and with experience. So I actually was a finance major undergrad, and then I switched careers after working on Wall Street a couple years. And my first exposure into medicine was actually with the very advanced heart failure population. So I was a lab technician running cardiopulmonary exercise stress tests where very sick heart failure patients being evaluated for transplant were put on treadmills, doing hard exercise, a lot of data points gathered through that sort of examination. And this first exposure to this very sick population always stuck with me, ignited my passion in medicine, and it's where I've always thought I can make the most difference.
That is really incredible. I love that journey that you took to get to medicine. When you see patients, they're often fearful. They're not quite sure what's going to happen. How do you guide them through the process of what care they need to hopefully get better?
Well, I like to slow things down and take things top to bottom. And I say that almost every time I'm meeting a patient for the first time. Review their entire case with them in words and methods that everyone can understand so that we're on the same page. They understand what I'm thinking. I understand what they're thinking, their fears, their goals with their care. And then we break things down and make a treatment plan that works for all of us. We have a lot of resources at St. Luke's, and I try to bring all of that to bear pretty much every patient encounter and have a comfortable patient experience, but one where we can really try together to achieve the best outcomes.
Thank you both for being here and explaining to us a little bit more about what you do and why you do it. We'll be right back after a short break, but before we do that, let's check in with Dr. Wilson out in the field as she shares an in-depth look at interventional heart care.
Cardiology has many facets and areas of focus. Interventional cardiologists, in particular, focus on the arteries that supply blood to the heart. And so when there's a blockage in the artery that supplies blood to the heart, we can go in, balloon, and stent it to open it up. Hi, my name is Kimberly Wilson, and I'm an interventional cardiologist at St. Luke's. I get to take care of patients who have heart disease, and heart disease can be anything from heart squeezing weakly to blockages in the arteries that supply blood to the heart. In medical school, I loved everything. And the wonderful thing about interventional cardiology is that I got to use my hands. It was even more impactful because my family, we have a lot of coronary artery disease. So I was just pulled towards that direction. And ultimately, I found a home with cardiology. And as an interventional cardiologist, I get to do what I love, care for patients, and then in some way sort of contribute back to a family history. The most common heart issue that I see and treat is really coronary artery disease and the prevention of acute events like heart attacks. You would see an interventional cardiologist if you're having chest pain. And let's say you saw your primary care physician or your regular cardiologist and they completed a stress test on you. And that stress test was abnormal. Then you're gonna get referred to me and I'll get a chance to see you in our cath lab and we'll take a look at the arteries that supply blood to your heart. Alternatively, patients come to us acutely when they're having a heart attack. And in that instance, we'll take them to the cath lab and we will open up arteries emergently. Patients who come to us in cardiogenic shock and have hearts that aren't pumping, we can put a pump in their heart through an access site in their groin and effectively pump for them while they recover from an acute heart attack. We can now take devices into the arteries and perform imaging like ultrasound, like OCT, to truly look at what the inside of a vessel looks like. And that's a huge advance. It helps us deliver stents more effectively. When we identify coronary artery disease that's significant and a stent is placed, the same disease can recur within a stent. So it's all about prevention. There are always opportunities to change and improve your heart health. So diet, exercise, cholesterol control, diabetes management, high blood pressure control, all of that matters even after we've diagnosed coronary artery disease. Most patients know when something's not quite right, and instead of waiting or delaying, I encourage patients to speak to their primary care physician or even their cardiologist to let them know that there's been a change in how they've been feeling. It is truly an honor to be a part of the St. Luke's team. I think the attention to detail, adherence to guidelines, and overall care of patients is probably why we were ranked so well. So patients can expect to be heard, the appropriate tests to be ordered, and the appropriate treatments to be provided. My hope is that patients feel well taken care of and cared for.
St. Luke's has been named a top 50 cardiovascular hospital in the country for the 8th time, and we're in good company. St. Luke's has the only local heart care team to be ranked in the top 50, along with Mayo Clinic and the University of Pennsylvania. This means our heart patients have higher survival rates, fewer readmissions, fewer complications, and better patient experiences. Using the highest quality healthcare standards, no other hospital in the region has better heart care. St. Luke's, my heart is in the right hands.
Welcome back to St. Luke's Health Now. Tonight we're discussing heart care and the many advances offered at St. Luke's. We want to thank you, our viewers, for tuning into our program and for submitting personal questions that we'll answer later in the show. Joining me are Dr. Jake Murray and Dr. Evan Joy, who are experts in heart and vascular care. Let's dive deeper into heart care offered at St. Luke's. Dr. Murray, I want to start with you. You mentioned being fascinated with the actual organ of the heart. Can you tell us in just plain terms, how does the heart function? It is complex and it is amazing.
I've had a lot of practice telling a lot of patients about how the organ works. I sort of break it down into almost a plumbing understanding, right? Most people understand pipes, squeezing pumps, things like that. And the heart has those characteristics. So one-way valves, everything moves in a singular direction, getting blood from one part of the body to the next, picking up nutrients along the way, oxygen along the way, and delivering it to where it needs to go. But more so than just a physical pump that squeezes closed, probably the most fascinating part is the ability for the heart to untwist in a way it actually works as a suction or a vacuum pump. And that's a very fascinating feature. And that's why we walk around all day breathing air into our lungs and not sitting in pools of fluid. It's just that's kind of the fascinating way it works.
It really is incredible. Dr. Joy, what are some of the telltale signs that someone might have a heart condition or have a problem? You mentioned fluid buildup, and I'm curious how that relates.
There's a number of different, classical textbook things to look out for, and these can reflect some of the situations that Dr. Murray is talking about with deranged hemodynamics, fluid pooling, blood not moving in the right direction at the right time. Some of these are subtle and some are not so subtle and very obvious. Things like shortness of breath. If activities that used to be able to accomplish easily, and a patient finds that they're having profound discomfort, especially if it's rapidly progressive and just not on their baseline, a new change, that things are tougher than they used to be, they're getting more tired out. These are some of the classic signs. Things like chest pain, chest pressure, the classic elephant sitting on your chest with pain radiating to your arm or jaw. You may find some of these things, and often you may not have anything like that. But these are some of the things that I think a lot of people have heard about. Sometimes very subtle things, just profound fatigue, palpitation, heart racing and thumping a little bit, dizzy spells that are a little bit inappropriate seeming to somebody. These are some of the red flags.
It's often hard to tell what is just maybe a little anxiety in your day-to-day life versus what's a problem. So what do you tell patients about when they should seek medical attention?
It can be subtle. And what I like to say and help patients understand is what their baseline is, and if there's a change towards the abnormal from that. Everybody's different. It's hard to know always what's normal and abnormal. There's a gray area in some situations. But often if people are noticing a little bit of a derangement or a change from how they normally function 6 months ago, 3 months ago, 3 weeks ago, 3 days ago, those are some of the things that they can look out for.
It also speaks to the importance of having a primary care physician to get that baseline you're talking about. Dr. Murray, how preventable is heart disease? We hear a lot about genetics, but are there some do's and don'ts you can do throughout your life to really lower your chances?
Numerous studies from diet, lifestyle, even advanced research genetic studies. Genes are certainly a prerequisite to sometimes develop a disease, but sometimes you can develop a disease just by poor lifestyle. Even genetic diseases are modifiable for the most part within cardiology. So many research articles have shown that patients can reduce the burden of heart disease or delay its onset by 10, 15 years just by introducing healthy lifestyles, even under a genetic diagnosis.
That seems well worth it to gain 10 to 15 years by changing your lifestyle. Give me some examples of what you mean by change your lifestyle.
So I would start with exercise, first of all. An active lifestyle, which usually requires something on the order of 30 to 40 minutes of exercise about 4 or 5 times a week, which is what most studies have shown. Diet would be second. We have so much on television advertising everything but most of the healthy foods. When was the last time you saw a red pepper or a piece of lettuce advertised on television? But keeping your diet slim in fats, stay away from fast food, keep sodium relatively low, and then obviously talk to your doctor about other things that they can find within your blood work panel if you have cholesterol prerequisites based on your family lineage or your diet. All those things are treatable and preventable as well.
You mentioned cholesterol, and Dr. Joy, I want to ask you, how much of a red flag are things like high blood pressure and high cholesterol, especially over an extended period of time?
They can definitely be a red flag. So these risk factors for heart disease, especially when uncontrolled for a long time, absolutely can lead to serious consequences with the heart and with a lot of other organs as well. There's many ways that these uncontrolled risk factors cause disease in the heart. A lot of different mechanisms can be at play, but one common pathway would be the progression and development of atherosclerosis, plaque buildup within the vessels, as well as vessel dysfunction itself. And over time, stenosis, decreased blood supply, vascular dysfunction, this can lead to a lot of untoward downstream effects, weakening of the heart muscle, and a lot of other problems with the heart. So if you have concerns or if you have a family history of these sort of things, definitely good to be aware and talk to your St. Luke's doctors.
When you say that stenosis, that's that hardening, shrinking, correct? So it was explained to me once that it's like you want to be able to drive an 18-wheeler through a tunnel. And if it gets to the point where all you can do is crawl through the tunnel with yourself, then you know you might have an issue.
Sometimes all it takes is a Fiat, but good blood supply is important.
Yeah. Absolutely. Dr. Murray, what about medications? There are so many medications out there. How long can people be on medications, and should they be a substitute for lifestyle changes?
I think everything is used together, and under the direction of a well-qualified physician, family doctor, cardiologist, any other specialist. I think the blend of pharmacology and lifestyle treatment is essential.
So not a magic bullet?
No, not at all, not at all. There are certainly some medications that are high risk, and absolutely we limit the lifetime of them, but they're few and far between. the vast majority of medications nowadays, which are in the hundreds to thousands, just within cardiology discipline alone, are quite safe to take long term. Still do require surveillance, blood work, things like that. That's why always communicating with your doctor. Most medications do require some sort of blood work every 6 months to 1 year. So we do sort of have a routine basis on which we survey the safety of most medications.
That's good to know, because you don't want to just take something just because it's available.
Nope, not at all.
Dr. Joy, what predisposes someone to serious heart issues when you start talking about what is congestive heart failure, and is there any kind of reversal that can happen there?
Congestive heart failure, there's a lot of different technical definitions of it, but you can think about it as the blood not flowing forward as strongly as it should, and the pressures in the chambers of the heart building up inappropriately. So the abnormal hemodynamic functioning of the organ. And there's a lot of things that can predispose to this. Some of these we've touched on a little bit. Uncontrolled serious risk factors like hypertension, cholesterol, diabetes, abnormal metabolic profile, being overweight, inactivity, but certainly a lot of other things that are a bit of common sense. Drug abuse, toxifying your body, alcohol abuse, things like this can absolutely predispose to serious conditions like congestive heart failure. And there's a lot of treatment options that we do have. As Dr. Murray said, there's many different pills that we use that work by different mechanisms to attack the problem, as well as the lifestyle modifications that we've talked about.
You mentioned this combination of possible, drug therapy with lifestyle changes. Dr. Murray, how do you counsel new patients about the role that they play and the role that you play in their health?
As Dr. Joy alluded to earlier, it's definitely a blend. It's a trust. It's a bond. I think if you don't trust your doctor, you're not going to be very forthcoming and honest with them. So you've got to have a good basis for a relationship there. So it really has to do with making sure that the patient understands the problem at its core. If a patient comes in with an electrical problem and you say, you need this procedure, without much divulging of information, education, we have patients with a wealth of information at their fingertips. Google, Dr. Google, as they like to say, right? So I think the part of this is educating them and helping them understand the disease process from the ground up, and making them feel like they're part of the team and that they have a shared decision making in this.
What role does a patient support system play in their overall health, especially as it pertains to their heart and their lifestyle choices?
Yeah, I think that's maybe somewhat of an age-dependent thing. A 45-year-old walks into our office, male, female, they're independent, they're in charge of their own health care. There's probably not a whole lot of support necessary in that, especially if you're talking preventive health. But certainly the family dynamic might be part of that. If everyone's eating poorly at home and the one person tries to change, it might be a little hard to change. There's a little bit of inertia against change there. If you're talking about someone who's a little bit more elderly, they might need some more support. Their caretaker at home, whether it be a spouse or a guardian, might be the one shopping for them. So you have to keep all of those facets in play to understand where the unhealthy choices might be coming from so that they can all be addressed.
That makes a lot of sense. Dr. Joy, tell us about the Advanced Heart Failure Program at St. Luke's. What is it, and how does that team work together for patients' health?
Sure. So the Advanced Heart Failure Program is quite robust at St. Luke's. We deal with very sick patients a lot of the time, often the sickest of the sick. So we get involved with patients who frequently have end-stage heart disease, end-stage cardiomyopathies, who may be refractory to their current treatment regimens. Things aren't working anymore. There's not a lot of options that they may have left. Sometimes we evaluate patients for powerful heart pumps implanted in the chest, or we refer out for heart transplant. While we don't do transplant within the network, we do have a strong base of colleagues in Philadelphia and in the local region that we work with when patients require these kind of treatment options. We also diagnose and treat complex cardiomyopathies and hard-to-manage cases. And there's a large team that we have. The Advanced Heart Failure team is comprised of a number of different specialists, especially when we're evaluating a very advanced case. We meet on a monthly basis as well as impromptu more urgently when that's appropriate. But they're specialists from a number of different fields, and we try to attack heart disease from all different angles. So we have advanced heart failure physicians, NPs, PAs, the cardiothoracic surgeons, psychiatrists, nutritionists, a strong cardiac rehab service in the network. So from every angle, we try to come at it and we work together, and we're kind of like a big family. And when there's a very sick heart patient that comes to our care, they do become part of that family, and we try to give them the best outcomes possible.
It's really incredible to know that there are such amazing services at St. Luke's available, and I guess the message is, if you think you need to see someone, go do it.
Absolutely. Doors always open.
Excellent. All right, up next we have some questions sent in from our audience. We'll get those right after this short break. Stay tuned.
Hi, I'm Aldo Carmona. I'm the Senior Vice President for Clinical Integration for the St. Luke's University Health Network. One of the things that makes us unique as individuals is our genetics, our DNA. The ability to have that DNA tested, screened for certain cancers, and then cataloged in your electronic health record is really a major investment in patients' health. As our capabilities grow for using the genetic knowledge in a patient's genes, we're able to provide more customized care, more personalized care to patients. And I'm very excited that we're able to bring this at no cost to the residents of our communities. As the executive sponsor of this DNA Answers program, I certainly participated myself. My family will be partaking in the study, and I strongly encourage you and your families to do the same.
I'm Kathy Rogers, and I recently had cardiac surgery for hypertrophic cardiomyopathy. I was very short of breath. I could only walk like a half a block without getting severely short of breath. I went to a doctor, and she referred me to a cardiac doctor. He noticed that I had a valve problem because I had another issue, which was the hypertrophic cardiomyopathy, which is an enlargement of the heart. My last resort was the open heart surgery. I was devastated because, you hear all the bad things that open heart surgery can create. But Dr. Sharani referred me to Dr. Olenchuk. He recommended the surgery. I'm going to do the surgery. I'm going to take care of you. And that's what he did. And I trusted him with everything. Today, I feel great. I'm still working. I work full time. We go camping, we go fishing, and I feel good. I have no murmur. I can walk. We exercise 150 minutes a week. All these doctors, they were all together, in tune. I couldn't have asked for better care. I don't think if I would have had them as physicians, I don't think I'd be here right now.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. We've had an engaging conversation about heart care at St. Luke's University Health Network, thanks to our amazing panelists. All right, now we're going to take some questions from our audience. You guys ready?
Sounds great.
Sure.
All right, Dr. Murray, I'll start with you. This viewer writes, I try to be heart healthy and keep an eye on my cholesterol levels. Can you explain the difference between HDL and LDL cholesterol, as well as triglycerides?
Sure thing.
That's a lot.
That's a lot.
Okay.
Pretty simple, though. Triglycerides are your energy source. You take it in from foods, hopefully not too much in the fat form, but it does come from most vegetable and animal fats. There's some healthy triglycerides as well as out there. We're at the liver level. The LDL particle is what helps deliver those food sources, those energy sources to the organs. But in too high a dose or in too high a concentration of LDL, LDL is a bad cholesterol, so high levels produce atherosclerosis, and they basically allow too much of that high cholesterol energy source to be delivered. HDL, on the other hand, is the retrieval source, and so it will bring back, efflux, so to speak, some of that back to the liver, which is then excreted via the liver. So it's a healthy balance. We want the healthy balance, so we want to keep LDL low. We want HDL to be relatively high, and triglycerides with the normal levels.
And I think that the name, or the acronym, says it right there, the LDL low, HDL high.
Absolutely.
There we go. Perfect. Dr. Joy, this viewer writes, I've never had high blood pressure, but both my parents developed it later in life. Even though I eat fairly well and I exercise, is it my destiny to have high blood pressure as I get older, or is it preventable? That's a great question.
I would say that it is unlikely to be your immutable destiny that you're going to absolutely develop high blood pressure that can't be modified or made better at all. High blood pressure is generally due to a mix of genetic factors as well as environmental factors. A lot of risk factors that can be addressed can make it much better. Things like diet, exercise, avoiding toxic substances, control of other contributory conditions. These absolutely can help bring down your blood pressure numbers and prevent development of related diseases from high blood pressure.
Sounds like they're on the right path, at least. All right, Dr. Murray. I'm 45 and have smoked cigarettes since I was a teenager. I quit 5 years ago, but I also put on about 10 pounds during that time. Is the extra weight worse than the smoking in terms of heart health, and do you have any advice? Another good question. A lot of people quit smoking.
Great question. Worried about their weight? Sure. In a world where obesity is mentioned all the time as an epidemic, absolutely. We want to be concerned about the weight. However, if you're a smoker at normal body weight, a BMI less than 25, and you put on 5 or 10 pounds, that's not going to put you in a very high-risk category. So I think it's about having a healthy weight to start with. Certainly a little bit of weight gain will happen and happens with the majority of patients who quit smoking, but there's really nothing to say that that's more unhealthy than the smoking itself. There's plenty of data showing how severe smoking is related to heart disease.
So certainly don't go back to the smoking.
And have a plan. Have
Okay.
a plan on what to do with that weight gain and how to address it.
Excellent, excellent advice. All right, Dr. Joy, this one is for you. My father has diabetes and high blood pressure, and he was just diagnosed with congestive heart failure. As caregivers, is there anything we can do to help him better manage his condition?
Absolutely, yep. Great question. And a lot of family members of heart patients are in this position. And caregivers are paramount to the care of the patient. And I often say that you're not just treating a patient, you're treating a family when somebody comes with serious heart disease. It's hard to be a patient, it's hard to be sick, and it's hard enough just to live like that and try to manage your own condition. There's a lot of different doctor's appointments, a lot of different medications, changing medications, modifications, different specialists, and then diet changes and entire lifestyle changes. Having a responsible caregiver invested in all of that, helping organize, manage, coordinate, and provide support materially as well as emotionally, this is crucial to good outcomes. And so if you're in that position, I would say keep doing what you're doing. It's definitely helping your loved ones.
Yeah, it's a lot to manage. There's the physical aspect, but also that emotional aspect as well. Speaking of emotional, I just want to ask before you both go, Dr. Murray, what is the advice that you give patients? What's the thing you want them to know about their heart care and the journey that they're on?
Trust your doctor. Just find someone you can really collaborate with, and who you feel has a good interest in your health. And the better that collaboration can be, the better overall the partnership.
That's great. And Dr. Joy, for you, what about the team? How important is the support team around you, your nurses, physician assistants, techs, to providing the care that your patients need?
It's extremely important. Medical care in the modern era couldn't be delivered without a very large team. Everybody brings something to the table, and it's absolutely essential. And I'm thankful that we have such a good team for advanced heart failure and other specialties at St. Luke's, but it's absolutely the most important to bringing good care to patients.
Excellent. Thank you both so much for being here and all of this insightful information. For more information on heart care and the services offered at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-ST. Luke's. Thank you for tuning in to this special episode. We hope tonight's program leaves you feeling informed, inspired, and most importantly, empowered. I'm Ashley Russo. See you next time on St. Luke's Health Now.